Thanks so much, Kylie, for joining us. So with us today, we have Professor Kylie O'Brien from Australia, a PhD in Chinese medicine, which in the Western world, incredibly rare as well, to my knowledge. I've not met many PhDs nor professors in Chinese medicine, Kylie, so absolute honor. Thank you for taking the time to speak to us about this and help us unpick some of the I guess, wonders of Chinese medicine and what we're missing out in the West potentially as well. And I was wondering if you might be able to start off, Kylie, with a little introduction to yourself and what you do currently, just to let people know who you are. And then we'll just do a bit of a story and lead into all the wonderful topics that you've covered throughout your life.
Okay, that sounds good. Well, look, currently I work in the cannabis industry. I work for a group called Relief Group, which is a franchise group with clinics and pharmacies that are focused firmly and squarely on medicinal cannabis. So part of my role there is doctor education, and part of my role there is research. I'm the Chief Scientific Officer, and we're actually running an observational study in medicinal cannabis. We've actually joined up with a UK group called Drug Science, and they're running an observational study called Project 2021 in the UK. Well, we're running the Australian arm through our Relief clinics in Melbourne and in Queensland. So, but my background before that was really in the field of Chinese medicine. So I have an undergraduate and a PhD in Chinese medicine. And before that, I was an optometrist for about 15 years and sort of segued into Chinese medicine via a master's in public health. So I've got a bit of a diverse background, I suppose, but been in the cannabis industry for 5 years, I guess.
As someone who's had a conventional training or sort of education in optometry, what is the sort of perception around Chinese medicine at universities in the West, and how was that sort of framed for you? What was the perspective around that at the time when you were?
I suppose it wasn't until probably around 1994 that they started to introduce degree courses in Chinese medicine into Australia. So I was part of one of the first intakes at RMIT University in Melbourne for their new Bachelor of Applied Science in Chinese Medicine. There was another university at the time that also offered Chinese medicine, but that was really the introduction to formal bachelor degree education in Australia around that sort of time, 94, 96. So it was very new in Australia, but having the education there at the bachelor level, and there was very much communication between Nanjing University and RMIT to develop the curriculum. And it's a strong curriculum. It's gone from strength to strength because they now have master's degree programs at several different universities, not just RMIT. But at the time, I guess Chinese medicine was the new kid on the block, and it wasn't until 2000 that Victoria, the state that I used to live in, was the first state in a Western country to regulate Chinese medicine via statutory regulation. Now, they were in some ways the test case for statutory regulation because it was state by state at that time, so it was only one state that did it. Right. Now, years later, in 2012, they actually regulated it nationally. So every state in Australia now regulates Chinese medicine like they do Western medicine and chiropractic and nursing and, those sorts of professions. So we all fall under one national umbrella called APRA. So at the time, I think it's probably, to answer your question, it started off as a new kid on the block, but because it had a solid foundation in education that was at bachelor level, it had the credibility, I think, and I guess in many ways it's become more accepted by Western medicos. So a lot of Western medical doctors actually practice acupuncture. It's not necessarily, they don't necessarily have the training of someone trained in traditional acupuncture because it's a 4-year or a 5-year degree in Australia or China. However, that just goes to show that at least the modality of acupuncture is very popular amongst Western medical practitioners in Australia.
It's striking me to be quite a similar story as well then for cannabis and how that's sort of on the block at the moment, and so maybe it'll follow a similar trend, I suppose, over years.
Possibly.
At the moment, Kylie, where is Chinese medicine up to in the West and Australia, and how do, I guess, Western doctors typically react when you talk about Chinese medicine, and especially for patients as well? How do they find that?
Look, I think there's a lot more acceptance now because a lot more doctors, as I said, they've taken on acupuncture as one of the modalities themselves. But I used to teach into a program many years ago at Swinburne University, and it was a kind of a diploma in integrative medicine. And my job was to give a 3-hour lecture to the doctors about what is Chinese medicine. And my brief at the time was, can you give them something they can use in their practice next week, sort of thing. Right. And I'd spend the first 10 minutes explaining why I wasn't going to be able to do that and give them something to play with next week, because it's a complete medical system. And by the time I'd actually walked them through the diagnostic system, the way that Chinese medicine understands the functioning of the human body, how they use herbal medicine, how they use acupuncture, at the end of it, most doctors go, wow, I didn't realise it was so complex. And yes, I now understand, no, I'm not going to be able to play with it next week in the clinic. It's not like just a herb and I can add that into, to give that to a patient. But I would now be happy to refer to a Chinese medicine practitioner. So I think once people start to understand that it is a complete medical system in its own right, they start to then understand the depth that Chinese medicine goes into. And of course, it's been around for thousands of years, so it's got a very strong basis of experiential evidence.
What are some of the main differentiating factors between Western and Chinese medicine? And for you, as you were going through that studying, learning process, what were some of the sort of leapt out to you as just complete paradigm shifts in?
And it is, you're right, it is quite a different way of thinking about the body. So, for example, different organ systems are not just sort of seen as the functional biomedical organs that we know in Western medicine. They have other different functions, and those organ systems are connected to different parts of the body. So, for example, the liver is connected to the eye via what they call the meridian system. And the meridian system is a system of pathways through which qi, a type of vital force, circulates. So essentially, the philosophical basis of Chinese medicine comes back to the theory of yin and yang, that you have two opposite but complementary forces that need to be in balance. This was part of many different aspects of Chinese culture, but it was subsumed into medicine eventually, and it became one of the guiding philosophies. So ill health was seen as an imbalance between these two forces of yin and yang, and health was seen as them being in balance. So they started to apply these sort of philosophical theories to the structures of the human body and explaining how physiological functioning worked and what happened when pathology occurs. And the other key concept, of course, is this concept of qi. Now, other cultures within Western culture had a similar idea of having some sort of vital force, but they couldn't quite measure it or see it or touch it, that sort of thing. So it remains something that is, again, a concept. You can think of it as a functional term or in a material sense, that we have a life force within our body. And so when we look at the Chinese medicine diagnostic system, it actually uses pulse diagnosis, so you will feel the pulse on both wrists, and each position on the wrist corresponds to a different organ system within the body. And so you're actually using your palpation to feel the strength, for example, of the pulse, how fast or slow it is. And you'll then start to, and the depth that you'll feel it most strongly at, and that starts to give you information about the person overall, but also those organ systems. Mm-hmm. So when I was an optometrist years ago, I was doing what they call tonometry on a patient, and I basically put a topical anaesthetic to numb the eyeball, and you press this instrument against the eye, and then you measure the intraocular pressure, the pressure within the eye. And when I did this to a woman, she grabbed her right hypochondriac region just above the liver. She just grabbed it with a hand. And she said, oh, I don't know why I did that. And I said, and I had done a little bit of background reading, before I moved into studying Chinese medicine. I said, well, I do. in Chinese medicine, the liver is connected to the eye. And so I just put something against your eye and you just grab your liver, essentially. So over the years, doing acupuncture, what you're doing is stimulating different areas on those meridian pathways, and they relate to different organ systems. And each acupuncture point's got different sort of functions. So the whole idea of health is quite different to Western medicine, but there are some parallels. So this idea of having a balance of yin and yang, or we could say homeostasis, is a similar concept, that the body has this ability to try and keep us in balance, whether you're talking about, aspects of blood or a circulatory system, etc., etc. We have an internal homeostatic sort of function, system in our bodies, and that's probably similar to this idea of keeping yin and yang in balance. So there are some parallels, but the whole idea of looking at how the body and why you get sick is quite different. So, for example, each of those organ systems has a related emotion. So the emotion that's associated with the heart, for example, would be joy. The emotion associated with the lung would be grief. And so the idea is that certain emotions can actually put the corresponding organ system out of balance. And often when you find that a person's got a lung condition, there's often, if you ask them, about what's happening in their lives, you often can find that there might be a parallel on that emotional level. So in Chinese medicine, emotions can cause imbalance in those organ systems. And the other sort of thing that's different in Western medicine, but perhaps also a little bit similar, is that these organ systems have, as I said, broader functions, but they're all interconnected. So it means that if you have some pathology in one organ system, it can actually, via its relationships with these other organ systems, cause another organ system to go out of balance. So in Chinese medicine, I guess the idea is to address the root cause. They call it the bin, B-E-N, bin, and also the branch or biao. So it's a bit like a tree. You've got the root cause of an illness, but the biao is the signs and symptoms that you might be manifesting at the time. So the idea is that you want to treat those symptoms because that's why the patients come in and that's what's causing problems for them. But you need to get at the root cause. What is the root cause of that illness? Is it something emotional? Is it dietary? Is it, what is it? And so with Chinese herbs, or acupuncture, you are seeking to treat both the signs and symptoms as well as the root cause. Whereas we find in Western medicine, there's a lot of attention sometimes to the signs and symptoms, perhaps less successful in some cases with, looking at the root causes and treating those. So there's just some of the differences, I guess, Chris.
It's interesting hearing this, because when you hear about and think about the neurochemical changes that occur in different emotions, cortisol when you're stressed, for example, being a great one.
That's right.
It does make sense. It's just interesting to see the parallels and
that is a very good example that you brought up, is that field of psychoneuroimmunology. And, so yes, you do find that Western science is just looking at it in a different way. I mean, in Chinese medicine, they call the heart as the seat of consciousness. Now, you'd think, well, hang on a minute, our consciousness, isn't that in our brain? Well, in fact, when you look at some of the research that's come out of the US, there's a group called the Heart Math Institute. They've done work on looking at the heart, and they look at heart rate variability and things like that. And basically, it's like we have a second brain, and sometimes the messages that the heart picks up go to the heart first and then the brain, not the other way around. We're used to thinking the brain is the boss and everything else is sort of secondary. But their research has sort of shown that no, sometimes you can receive the heart first, then the brain. So you sort of think, well, this idea of the heart being the seat of consciousness that the Chinese, in Chinese medicine for thousands of years, maybe they got it right.
Yeah.
In some ways.
It's almost two sides of the same coin in a way, but just coming at it from different poles and seeing
exactly
isomers of medicine in a way. I don't know if that's maybe a term, but it's just for people who've maybe not had. Well, this is maybe more or less my first real exposure to and conversations. What are some of the more difficult aspects that people struggle with understanding, coming to terms with, and
Yeah, and look, I think a lot of people, I mean, patients who come to Chinese medicine practitioners, I think have already got an openness to sort of think about their health in different ways. A lot of people who basically say, oh, there's no evidence for it, really don't know what they're talking about because I guess Chinese medicine has been put under the microscope in various kinds of scientific studies for many, many years. So I guess sometimes it's just a little bit difficult when we look at Chinese medicine treatment, they'll use herbal medicine, but they'll use combinations of herbs together, for example. So there might be anywhere between 4 and 15 herbs in a medicinal formula, and they're not just thrown together randomly, they're deliberately chosen. This means that you can treat a number of different signs and symptoms at the same time because you've got many different therapeutic actions of each of those herbs in combinations with others. Whereas I guess with Western medicine, we're used to trying to find an active constituent and take that out of a plant, synthesize it, make it a little bit different so we can put a patent on it, and voila, we have a drug that we can sell. So there's a little bit of a difference in, as I said, the approach to treatment with medicines.
This is ringing some cannabis bells now, Kylie, thinking about how that's happening in cannabis, that being a herb and the Western world trying to isolate THC and all these, the one man bullet phytocannabinoid or compound that's going to cure all disease.
That's right.
How, I guess, in that sense then, Kylie, what could we maybe learn from Chinese medicine and how we integrate this into our Western medical model that we have at the moment?
I think you've in terms of sort of the field of starting to understand cannabis, I think you've just sort of almost alluded to it right then. It's that that we sometimes think that we want to take out an active constituent, we want to take out THC and synthetically copy it, and companies have done that. So there's synthetic THC drugs on the market. Or we want to take out CBD and we want to use it as an isolate. Whereas in plant medicine, in herbal medicine, we tend to sort of use the fact that you've got many different compounds within the one plant. And so many of those, and they call that the entourage effect, where you have, some of the terpenes and minor phytocannabinoids are contributing to the overall therapeutic effect, that it's not just CBD or it's not just THC, it's the combination of these others that gives the overall therapeutic effect. So I think that's an important thing to look at when we study cannabis, because, of course, a lot of preclinical or animal models in research have used CBD isolate or THC isolate. Now, it's hard sometimes to extrapolate from an animal to humans to say, does it behave the same way in humans? But we've also got to remember that if you've done research in an animal and you're using an isolate, is that going to be different if you're using a whole plant, a full spectrum product, or even a broad, spectrum CBD product, something like that? It's likely to act differently. Now, there was a very good study in 2015 by a fellow called Galilei and co, and it looked at basically pore swelling so they set up a pore swelling model in a mouse, and they looked at CBD isolate versus a whole plant CBD product. And they found essentially a very different dose response curve when they looked at pore swelling or pain threshold. So they found a U-shape or bell-shaped curve for those in the isolate. But when they used the whole plant product, they actually found a straight, a linear dose response. So in other words, there was no sweet spot. The more CBD you put in, the better the response. Whereas with the isolate, they got this sort of, wasn't very good at the small dose, wasn't very good at the high dose. The best response was somewhere in the middle. So it brought home a very clear point to me that when you look at the literature, you have to really say, well, is it using CBD isolate, THC isolate, or is it using a whole plant product with lots of different phytochemicals in there? And I think we've got to do research how it's used. So, you might sort of say, well, yes, that's useful if you're going to look at just a THC synthetic product. Yes, you're going to just, do that. But for other studies, we need to be looking at the medicines, the whole medicines.
I've just been sat there thinking about football and how when you take the main striker from a football team, they don't always
Yeah.
perform as well at this new as they do
Yeah.
at this. It's quite a strange, yeah. Anyway, that
Yeah.
came to mind anyhow as a bit of a well, that was the image that was provoked there, Kylie.
Yeah.
Um,
Yeah.
you were mentioning, going back to that point about, I guess, the chemical bounty within cannabis that there is. Going back to some of those Chinese medicines, when you think
Yeah.
about it, you've got 15 herbs potentially in a medicine. You've
Correct.
got God knows how many potential
Exactly.
chemicals, and in Western
Yeah.
medicine, Western research, that would be pulling your hair out sort of procedures. So
Sort of say, does
how does a Chinese medic manage that?
mm,
And going back to that point that you made as well about that being quite
mm,
a selective process, what is the process in
yes.
Chinese medicine versus say
Okay.
medicine where we try
Yeah.
and find that one magic bullet?
So one of the distinctive characteristics of Chinese medicine is that you treat what they call the underlying pattern of disharmony or symptoms. So let's say you've got a disease. We'll call it, it could be anything, but it's a disease label. Now, not everyone is going to have what they call a different pattern of disharmony, and most diseases are going to have somewhere between 4 and 6 patterns of disharmony. Now, that basically means a characteristic set of signs and symptoms that are reflective of the underlying pathogenesis as understood by Chinese medicine. So, for example, and they have weird names, so they might say that you've got diabetes would be the name of the disease, or Shaoke in Chinese, but a person might have kidney yin deficiency. Someone else might have lung yin deficiency, etc. And because you've got a different diagnosis in terms of yin and yang and other factors, you will use very different herbs to treat it. So you might have 10 people, they've all got a particular disease, but you're going to treat the pattern of disharmony with quite different herbs from one to the other.
Okay.
So if you've got a kidney yang deficiency, for example, you would predominantly use more warming herbs, because in a condition like kidney yang deficiency, you're going to have some cold symptoms. Whereas with kidney yin deficiency, you're going to have some heat symptoms, and so you're going to use more cooling herbs. That's just at a very basic level.
Yeah.
So in other words, you are choosing the herbal formula according to the pattern of disharmony. So that, and back in ancient China, there was many centuries devoted to, I guess, compiling different medicinal formula or combinations of herbal medicine that were tried and tested. And so then they would basically be rewritten in the next dynasty, where they compiled all the materia medica, which is basically an encyclopedia of herbs, and the medicinal formula as well. So they had books on those. And so every sort of time there was a dynasty change, they would revise and revise and revise this. And so the pharmacopoeia of herbs got bigger as they got more experiential evidence on what they happened, what they did, and you got bigger groups of, I guess, books of formula and things like that. So it ended up sort of growing over centuries. So that's one sort of difference, is that Chinese medicine evolved over centuries, not just the last couple of 100 years. The formulas or combinations of herbal medicines very, very much tried and tested, I guess, and I guess that's a little bit of a difference that I see with perhaps Western medicine, is that it's comparatively younger in some ways.
It's interesting that there's an element of personalization as well to Chinese medicine. It's not just a sort of standardized, everyone gets this
Correct.
formula. It's
yep. That's right. Yeah.
Elements that Western medicine's just sort of catching up with and just starting to implement and take seriously now.
Yeah, so that idea of personalised medicine, that's right. So Western medicine is catching up, but you're quite right. In Chinese medicine, even if you chose a particular medicinal formula for someone, if they had particular signs and symptoms, you would modify it, and you'd add in other herbs for that particular person's signs and symptoms. You would also look at their age, their constitution, and modify it according to those factors as well. So, yeah, it's very much around personalised or individualised approach to medicine.
Moving forward then, Kylie, how have you carried all of this into the ICCM and the education work that you do now within the cannabis industry? And
Yep.
Yeah, how's that been?
So I guess I started in the education area in 2018 when there wasn't a lot of education for doctors and pharmacists in Australia. We found that there were a lot of oils in bottles being sold and imported into Australia. So much of our teaching was sort of around understanding the different ratios of CBD and THC. But as we started to get more patients demanding flower, then we found that flower is starting to overtake oil in terms of popularity, and more doctors are very comfortable with prescribing flower. Now, one flower is not the same as another flower, as you know. So you've got hundreds of different cultivated varieties or cultivars, and each of those is going to have a different phytochemical profile. It's going to have a different profile of the phytocannabinoids like THC and CBD, but also the minor phytocannabinoids. It's going to have different key terpenes and amounts of those key terpenes in there as well. And so what I guess my teaching and education sort of evolved in is to try to get across to doctors, and look, it's not just about the rock stars THC and CBD, but let's have a look at those minor phytocannabinoids. Let's look at the terpenes, because if you start to understand that they've got therapeutic actions too, you can probably start to match those cultivars more towards that patient in terms of their clinical condition, as well as perhaps that individual patient as well. So I think we're moving to a point of starting to be more sophisticated in targeting particular cultivars for particular problems. Now, this is probably not new to the bud tenders over in the US, because they knew their cultivars, they know their cultivars very, very well. And so they often can just advise, look, I think this one would be a good one for you, because they've probably had first-hand experience of using a lot of them anyway, which is a great form of learning. But as I said, this is where I sort of see that, at least my knowledge of herbal medicine, Chinese medicine coming into it, is to say, look, a whole plant medicine is going to be probably a lot more powerful and useful and therapeutic than a synthetic copy or an isolate. And I'm sure there'll be people that will, argue with that. But I often say that, nature wasn't stupid, but humans often are. And we often think that we can do better than what nature provided for us. So I guess that's where my teaching has evolved. And the ICCM really is an online learning platform for healthcare practitioners to learn about the evidence base of medicinal cannabis, simply because I think there's a need for it. So I've got experts from all around the globe presenting 30-minute videos. Each one's got a 10-question quiz. You can download a certificate of completion for continuing professional development purposes. So we've got over 55 videos in the video library at the moment. We've got a free foundation course, which is 12 modules that anyone can sign up to and do. But it's really about sort of saying, look, let's demystify cannabis. Let's teach healthcare practitioners not to be scared of it. It's a plant medicine. You've got to be careful in certain, there's always, safety concerns with any kind of plant medicine. You need to understand those as well. But you also need to understand that there is a fair bit of scientific evidence around if you take the time to actually look at it.
On the note of that scientific evidence, quickly, Kylie, before we have to wrap up, you've written a Springer book. Could you tell us more about that, Kylie? Because that's quite a unfathomable process and quantity of work put together. So the last few minutes, I'd love you to learn more about that process and what that was like. Yeah,
look, the book that I published last year was with my colleague, Dr. Philip Blair in the US. He's a retired Army colonel and a family physician. So we wanted to, the reason we wrote it was to actually show that there is evidence around various conditions. We chose mental health as the topic of the book, so it's called Medicinal Cannabis and CBD and Mental Health Care. And we took an approach of explaining what we understand about pathophysiology from a Western perspective, how the endocannabinoid system is involved, and then what is the actual evidence that, preclinical evidence from animal models, that sort of thing, as well as human evidence that medicinal cannabis and some of its key components like THC, like CBD and some of the terpenes may be useful in addressing it. So there's different levels of evidence, I suppose, for different conditions. But, anxiety, there's a reasonable amount of evidence there, for example. There's less human evidence for other conditions, but it doesn't mean there's no evidence. So, and we finished each chapter off by talking through some case studies from Dr. Blair's practice. So the purpose was to sort of show, well, look, there is evidence, and it's a growing body of evidence, but there is evidence around it, so that, you know, I think it's naive to say, well, look, there's no evidence that cannabis works. So it was taking, I guess, the best of Western medicine, which is talking about evidence-based medicine. What is the scientific evidence around that? Now, that's not perfect. We know that there's flaws in scientific methodology. However, we use the best of that to sort of say, well, given the limitations of a randomised controlled trial, what do we find anyway? You know, what do we find in case studies, which are a different form of evidence? So it's trying to be able to be broad and say, well, there are different types of evidence here. Let's have a look at it. And overall, what does it say about this condition and whether cannabis might be useful?
For the next few years in medical cannabis, what do you think are some of the trends that we need to be aware of? And just finally, what do you think comes still for medical cannabis in Western medicine and Australia, I guess globally as well? What do you think's next?
Yeah. Look, I think certainly in Australia, I think there's more and more attention to flower. We've got some regulatory changes. It's still only able to be prescribed by doctors here, for example. So CBD oil, you can buy that in a health food shop in, you know, various states in the US and parts of Europe. But here, a patient has to go to a doctor and get it prescribed and then pay $200 or $300 for a bottle of oil. So there are changes where they are now going to allow CBD products to be on pharmacy-only medicines. But the problem is, and that means that you just go in and you can talk to a pharmacist and get the CBD oil that way, but I don't see that rapidly bringing prices down. And the other thing is that none of the companies hold the randomised controlled trial data to get it on a Schedule 3 at the moment anyway. So the mechanism's there, but it's you know, it remains empty at the moment. We did have an attempt to get CBD products off the schedules totally and just regulate it like any other herbal medicine, but it wasn't successful. The TGA actually put in their own submission against that, and of course they won, the Therapeutic Goods Administration. So the best that they come up with is to downschedule CBD products to Schedule 3. But as I said, products have got to have the evidence to be able to get onto Schedule 3. So that hasn't happened in the next couple of years. Yes, that evidence will probably be there, so that'll be a bit of a change in Australia. But I think there's a movement to try and change things in Australia. There's more and more patients want it. They want adult use. They want recreational use. So I think in the next 5 years we may see, and it might be another government change before it happens, but I think we'll probably find that eventually recreational use or adult use of cannabis will be allowed. We've got one state, or it's one territory, the Australian Capital Territory, that have basically allow recreational use now with various stipulations around it. But you can have up to 50 grams, for example, of dried cannabis. You can have 2 plants per person, with up to 4 plants per household. But the problem with our country is that any amount of THC in your body when you're driving is breaking the law. Yeah. And so this is very difficult. Doesn't matter whether you've got a prescription or not. Doesn't matter whether you're impaired or not. So I'm hoping within the next 5 years that those, you know, laws change. So we follow perhaps more the Canadian model, where you have to be shown to be impaired before you're going to be breaking the law, that having some THC in your body doesn't automatically make you, you know, a felon. So there's some of the things I sort of see perhaps that are on the horizon for Australia. Meanwhile, around the world, we've got countries like Thailand opening up to, you know, legal use. You know, years ago, you would not have even dreamed that Thailand would be one of the leaders in Asia. You know, if anyone grew up around my time, we were watching Bangkok Hilton, the film with Nicole Kidman in it. We're all terrified, you know, that you could, you know, their harsh drug laws. Yeah. But there you go. So, you know, I see certain leaders emerging in the areas of Asia, Africa as well, that they're starting opening up to hemp production in a big way. So I just sort of see that there's going to be a lot more movement. I think we here in Australia are a little bit behind.
Certainly as well in the UK, it seems as though this sort of question of intoxication and cannabis in the blood hasn't quite been thought through so well, and that we're going to give these patients and people cannabis and CBD products, but not really update any of the other contextual laws around that might be affected. So it's, yeah, interesting that the same sort of problems are popping up North America, Australia, Europe as well.
Yes, that's right.
Well, I want to say, Professor O'Brien, thank you so much for making the time to talk us through Chinese medicine, cannabis, the future of cannabis in the Western world as well. And if anyone does want to follow any of Kylie's work, I'll put all of her links in the description, and hopefully we'll get some links as well there for the ICCM so people can take some of your lovely courses, Kylie. It's time for some dinner for you, I think, isn't it? So
it is. It's dinner time here in Australia. So yes, I'll now love you and leave you. But thank you very much for having me as part of your show.
No, thank you very much, Kylie. We'll definitely talk some more and see if we can circulate some more, I don't know, inter-hemisphere conversations between Australia. But yes,
sounds great.
Thanks so much for making some time. I hope you have a beautiful dinner, and I'll go have some breakfast as well. So thank you very much, Kylie, and we'll see you soon.
Thank you very much, Chris.